Welcome back to TV5 News at 9. Today we are talking about recurrent disc herniations. Joining us this morning is board certified neurosurgeon Dr. J. Jaganathan. Thank you so much for being here.
Thanks for having me, Chloe.
You're welcome. Okay, before we get started, your practice, Jaganathan Neurosurgery, recently received an award. Tell us about this. This is so exciting.
So we were designated as a musculoskeletal center of excellence for spine by Blue Cross Blue Shield of Michigan, about probably about 70-80% of our practice centers around spine. Both myself, my neurosurgery colleague Dr. Kramer, as well as my colleagues in pain management. So we were very happy to get that recognition and hope to continue to provide service to the patients in the community.
Congratulations. That's great to hear. You're welcome. Now to recurrent discs. What are they and why do they develop, doctor?
So as the name implies, recurrent discs are discs that reherniate and cause pressure on the nerves when they've already been removed. And the logical question is, why would they reherniate if they're already taken out? And that can be from a variety of causes. Sometimes it can be caused from instability of the spine. Sometimes it can be caused during the original surgery by not removing enough bone or disc that's pushing on the nerve. And there are some patient factors such as obesity and tobacco use, which may play a role in disc reherniating as well.
And what are some of the symptoms that we should be on the lookout for?
There can be a variety of symptoms. It ranges from pain and weakness to numbness and tingling. Oftentimes, patients, when they come back, will have similar symptoms to what they had before the first surgery. I mean, classically, patients will notice that their symptoms got better for a little bit and then started recurring again, which is sort of a red flag for it.
Well, let's ease people's minds out there, doctor. Tell us about the treatments that are available.
So there are a variety of treatments. It really depends on the pathology and the time between the surgery and recurrence. Oftentimes, especially if it's been a while since a patient may have had surgery, we would start with physical therapy and what we call conservative or non-surgical methods, such as steroid injections, to see if the symptoms get better or the disc heals itself with time. In certain cases, repeat surgery might be needed. In cases, for example, where a patient wakes up and does well for a day or two and suddenly notices the pain recurring and the disc herniates, it might be easier just to go back in and take the disc out. Since the wound and the pathway to getting there is still pretty fresh.
And Dr. J, what are the surgical options for recurrent disc herniations?
That's a good question, and it depends on the extent of the pathology. It can range from revision discectomy, meaning that you go in and take the disc out again. One of the concerns, particularly in patients where it recurs after several weeks or several months, is that there may be some instability or abnormal movement in the vertebrae itself that causes the disc to herniate. And those kind of cases, a fusion where you eliminate that motion and remove the entire disc may be necessary to eliminate that abnormal motion.
And Dr. J, if anyone wants to learn more, where can they go for more information?
They can visit our website, www.mi-neurosurgery.com, or call our office anytime at 989-701-2538.
Well, thank you, Dr. J, again for joining us this morning.
Thank you very much, Chloe.
You're welcome. And you can find a link to all the information Dr. J was talking about in the hot link section of WNEM.com.